Good afternoon, everyone. Thank you for joining us to discuss the initial preventive physical exam. My name is Karen Curtis, and I am a provider outreach and education specialist here at WPS. Ashley Dakota is helping me out today. She's going to be watching for questions that come through in the chat and providing you with some additional information during the webinar. Earlier this month, I held a webinar on the annual wellness visit and found that there was some confusion when it comes to the different physical exams that are covered by Medicare. I'm making air quotes when I say physical because Medicare defines these yearly exams in different ways, and each one has different coverage. The Recovery Audit Contractor, or RAC, has found issues with billing excessive units, billing sooner than the patient is eligible to receive the service, and incorrect coding. So I'm hoping that I can clear up some of the confusion so that your claims could get billed correctly. Today we're going to talk about the initial preventive physical exam, which is also called the Welcome to Medicare exam. I'm going to discuss the different components of this exam. We'll talk about how to submit claims to Medicare. We'll discuss eligibility, and I'm also going to provide some resources that hopefully will help answer any questions that you may have. Now, on the bottom of this slide, you're going to notice a little footnote regarding disclaimers, and there are a few slides at the end of the presentation because I include CPT codes and information that is used on a UB04. So there are some copyright notices. So I want to start out with some definitions. There are different types of exams that can be provided, and each of them have different coverage. In the world of Medicare, when we talk about physicals, there are 3 exams that likely come to mind. The initial preventive physical exam is for beneficiaries who are new to Medicare, and it's often referred to as the Welcome to Medicare preventive visit. This exam is done within the first 12 months of entitlement to promote good health and disease prevention by reviewing the patient's medical and social history. Since the patient is new to Medicare, this would also be a good time to discuss the different preventive services that Medicare covers. The annual wellness visit is an exam that occurs after the initial 12 months of Medicare entitlement. The goal is to provide recommendations which help patients live a healthy life. This can include developing or updating a personalized prevention plan and performing a health risk assessment. A routine physical exam is a visit that is not related to a specific illness, symptom, complaint, or injury. These forms of physical exams are not covered by Medicare. We'll start out with a couple of requirements. The IPPE should be performed by a doctor of medicine or osteopathy. This service can also be performed by a qualified non-physician practitioner. The Code of Federal Regulations states that for purposes of the IPPE, a qualified non-physician practitioner refers to a physician assistant, nurse practitioner, or a clinical nurse specialist. The exam should also take place within 12 months from the date that the beneficiary was entitled to Medicare Part B. So what services are included in the IPPE? First, talk to the patient about their medical and social history. Find out if the patient has any allergies or illnesses. Are there past surgeries or hospital stays? This is a good time to discuss the health of the patient's parents, their siblings, children, things like that. Identify conditions that could be hereditary. This is going to allow you to develop a plan on how to provide the best care for each individual. You'll also want to determine if the patient is currently taking any medications or supplements. It seems like there's information all over social media nowadays about the newest and greatest supplement and how it's going to cure any problem that you may have. Is the patient physically active? Do they get involved in social activities? It has been found that individuals who have strong social connections have a lower risk for health conditions such as heart disease, stroke, dementia, and depression. Having someone to talk to makes us better equipped to deal with stress and life's challenges. Establish what kind of diet the patient has. Are they eating a balanced diet or are they relying on fast food? Lastly, discuss any use of alcohol, tobacco, or illegal drug use. Next, review the patient's depression risk factors. This could include current or past experiences with depression, any other mood disorders. There are a variety of standardized screening tools which can be used. The Medicare Wellness Visits education tools does have a link that can provide you with available instruments. I have included a link in the resources and we will take a look at that a little later. Review the patient's functional ability and safety level through direct observation or screening questions. Is the patient having problems with daily living? Are they still able to access all areas of their home? Now, as people age, steps may become harder to navigate, so maybe ask if they've fallen recently. If the answer is yes, then maybe ask, does it occur frequently? This could lead to discussions as to whether the patient needs assistance, maybe from family or caregivers. Maybe the patient can't continue living in their current situation, and maybe the family needs to look at assisted living facilities, something like that. Perform an exam. This could consist of taking measurements such as height, weight, body mass, index or waist circumference, blood pressure, balance and gait. A visual acuity screening is also included in that. If the patient agrees, end of life planning can be discussed. This discussion can include advance directives, helping beneficiaries fill out legal forms to make sure that their wishes are carried out. Some examples would include like a living will, maybe medical orders for life-sustaining treatment, durable power of attorney, things like that. A living will and medical orders for life-sustaining treatment allows patients to make decisions regarding what medical treatments they would or would not want to be used to keep them alive. A psychiatric advance directive could be discussed. This allows people with mental illnesses to make sure their wishes are known prior to emergency occurring. There could be directions for childcare. Maybe they want somebody to contact an employer if anything would happen to them. Just all of these type of end-of-life planning things. Many of these forms, if they are interested, can be found on your state attorney general's office website. So that's something that could be printed out for them or they could be given that address. If the patient has an opioid prescription, screen for an opioid use disorder. I'm sure we can all agree that there is a huge opioid crisis, so evaluate their current treatment plan to see if maybe changes could be made. Maybe they can switch to a non-opioid treatment plan if that's possible. Screen for any substance use disorders and refer to treatment when appropriate. Provide personalized health advance and referrals. So take in all the information that you've gathered and provide education based on your findings. Maybe the patient could benefit from one of the other Medicare preventive services, such as diabetes prevention and training programs. Depending on the identified risk factors, maybe counseling for smoking or alcohol misuse may be appropriate. Lastly, provide a brief written plan for the patient. This can include an optimal screening electrocardiogram and other appropriate screenings. So next, let's take a look at the coverage requirements for this service. The IPPE is covered under Medicare Part B. Coinsurance and deductible are waived for the actual examination, but they would apply to the electrocardiogram if it is ordered. And this is a once in a lifetime benefit, and it should incur within the first 12 months of Medicare Part B entitlement dates. Now, I wanted to pull some data to see what the rejections were that were related to IPPEs. Frequency rejections are the most common. This was followed by entitlement rejections, meaning that the services weren't received within the first 12 months of entitlement. And then lastly, we have missing, incomplete, invalid ordering primary identifier. So what can be done to avoid these rejections? First is check the patient's Part B entitlement date and make sure that the services are being performed within the first 12 months from that date. You can perform an eligibility check to see if the patient has already received their Welcome to Medicare exam. This can be done by asking the patient, also checking the WPS Secure portal. We'll take a look later, but that information is available on the Preventive Screenings tab of the eligibility check. I also did hold a webinar yesterday regarding that information. You can also get this information from HETS or a clearinghouse or a billing service if that is something that you use. Lastly, check the provider information and make sure it's being billed correctly. So, MPIs, physicians' names, PTANs, things like that, just make sure everything's being billed correctly. So next we'll move into how to submit those claims to Medicare. When submitting claims to Medicare, you're going to want to use code G0402 for the IPPE. Codes G0403 through G0405 are going to refer to the once-in-a-lifetime screening ECG that may be performed if appropriate. CMS does not require a specific diagnosis code to be billed with this service, so the code should be consistent with the patient's exam. Now, if you are a provider who submits claims on a CMS 1500 or an 837P, then the type of service listed for the IPPE would be a 1, while the codes referencing the electrocardiogram would be billed with a type of service 5. Claims that are submitted on a UBO4 or 837I would need to include a type of bill from one of the facilities shown here. So you can see there is quite a variety of facilities that can bill for this. You've got hospitals, critical access hospitals, skilled nursing facilities, rural health clinics, and federally qualified health centers. Now for RHCs and FQHCs who bill under the all-inclusive rate, this is also known as AIR, payment for the professional services will be included in the AIR payment. Charges should be sent on a type of bill 71X or 77X, depending on your facility type. And claims should include the appropriate site of service revenue code in the 250 series. And it must include HCPCS code G0402. Now, if the optional electrocardiogram is performed, then the professional component is included in the AIR rate and is not separately billable. Now, for FQHCs who are billing under the Prospective Payment System or PPS, HCPCS G0468 may be billed using an appropriate site of service revenue code in the 520 range. G0468 is used when the visit includes an IPPE or an annual wellness visit and a typical bundle of Medicare covered services that would be furnished per diem. The Medicare Claims Processing Manual, Publication 100-4, Chapter 9, does provide payment examples for claims that include HCPCS G0468 along with other services. So I have provided a link for that on the resource slide. So if this is something that you would be interested in, it did give multiple examples. So I thought that was nice. If you are an OPPS hospital billing on a type of bill 12X or 13X, CMS has provided special instructions when the technical component of the electrocardiogram is billed on the same claim as the IPPE. You're going to want to be sure to include modifier 25 when you submit HCPCS code G0402 along with HCPCS G0404. This is going to help avoid any edits that could be received by the outpatient code editor. Now, there may be times during an IPPE when a problem or an abnormal finding is significant enough that it warrants a problem-focused evaluation and management. The evaluation and management must be performed on the same day as the IPPE. It should be separately identifiable, medically necessary, and related to a treatment of an illness or injury or to improve the function of a malformed body part. When determining which code is appropriate, services that were provided as part of the IPPE, such as reviewing a patient's medical history or routine measurements, should not be included in the decision-making process. Modifier 25 should be included on the line containing the evaluation and management code. Now, I do want to take a little time to talk about how you can check eligibility. We want to make sure that beneficiaries are receiving these services when they're needed and that you're not getting your claims rejected with frequency edits. You do have a few options when it comes to checking patient eligibility. We have the WPS Secure Net Access Portal, which is often referred to as the portal. Users must be registered with WPS to view a beneficiary's eligibility information. When you visit the WPS website, there's a box which takes up the majority of the screen, and this is where you can register or log in if you already have an account. The summary tab within the eligibility check is going to show you the patient's Medicare entitlement date. So there's the first place that you'd want to look to see, okay, when did they get entitled to Medicare Part B, and are these services being provided within that first 12 months? The HIPAA Eligibility Transaction System, or HETS, provides access to eligibility data in a real-time environment. This option does involve submitting files via electronic data interchange, so a trading partner agreement is required. Lastly, if you use a clearinghouse or a billing service, that is also an option that you could contact and they could provide that information to you. Now, for those of you who are not familiar with our portal's eligibility, I did want to include an example of the Preventive Services tab so you can kind of see what it looks like. This tab allows you to determine if the beneficiary has already received their IPPE. So if you went out here and you saw that there was a code, it'd have a kind of a title like what you see on the slide, but if you saw one for the IPPE, you would know that the patient did already receive that service and they would not be eligible. Now, I have provided some resources that I hope that you guys could find helpful. I'm not going to go through all of the Medicare Claims Processing Manual, but I do want to go through the Medicare Preventive Services tool and the Medicare Wellness Visits tool. We're going to start with the Medicare Preventive Services tool. This is really a tool that I show in all of my preventive services webinars just because I think it has a lot of good information and it has all of the preventive services in one place. I also find that they put the information very user friendly, so it's not difficult to understand what they're trying to say. Um, if you see a little T with a circle, that means that those services are eligible for telehealth. We are going to take a look at the initial preventive physical exam. So you can see, I also like it has this little box here with what has changed. So if there is any updates to any of the coverage or any types of codes or anything like that, it's going to be found right here in the what's changed. So you're always going to know what updates have been made. But this starts out and it gives you the HCPCS codes that could be used to bill for the services. It does list if there were specific ICD-10 codes that Medicare required, you would find them under the ICD-10 code heading. It does give you the Medicare coverage, talks about frequency. It also gives you what the patient pays. So for the actual IPPE, there is no copayment, coinsurance, or deductible, but you can see that if the patient did receive the ECG, then that would be applied. It also gives you some additional information about that code we talked about for the FQHCs, and it provides you a link to the manual if you want to get more information on that. I would also like to call your attention to this information down here. Since this is their initial Medicare visit, there is a preventive services checklist. So we had said that maybe that was something that you would go over with the patient. So this does give them a list of all the preventive services that are covered by Medicare, and they can kind of be checked off. Patients can put notes on here, dates when they got the services. So just something to kind of help them keep track. And then I also wanted to show you here the Medicare Wellness Visit. This is actually the second resource that I have listed on the resource slide. This is going to give you information for both the initial preventive physical exam and the annual wellness visit. We're going to click on here. This used to be, CMS recently started redoing, sorry, all of their Medicare Learning Network resources. This used to be a book. It kind of looked like a book form, but they're changing everything in their Medicare Learning Network, so now it kind of has its own web page. But I do like this because it lists the components, and if you click on this, it goes through each one of those components that we talked about earlier, and it tells you what's included in that, like the different elements for that actual component. So that kind of could be a checkoff list for the provider to make sure that you're getting through all of those resources that they're asking about. Now, I will tell you that where it says at a minimum collect this information, if a claim happens to get reviewed by our medical review department, this is what they're going to look at. Were these different elements touched on? That's what they're going to look for in the documentation. So that's something that you'll also want to pay attention to. We talked about how there's different links in here. So here's the depression assessment instruments. And you can see there's a lot of additional information that you can find in these. They have provided links for those things. If we scroll down, this also gives coding, not in as much detail as what the manual gives or what we kind of talked about during the webinar. Diagnosis codes, and then it also gives billing information. And here's the information about the evaluation and management. It also gives you additional resources in case you wanted to find more information on the IPPE. So I just wanted to show you those two resources I think are really good, and I think they provide a lot of information. go back to the webinar. The other ones, oh, sorry. This, just the manual references, they do provide a little bit more detailed information, but sometimes I find it's not always the easiest to read. Now, before I ask Ashley if any questions have come through in the chat, I did receive some pre-submitted questions and I want to be able to provide some answers to those questions, so I'm going to cover those first. The first question I got was when combining an annual wellness visit, which since this is an IPPE, I'm just going to address it as if it's an IPPE, with evaluation and management visit for chronic diagnosis. So for example, COPT, HTN with labs, things like that. What is the documentation required to justify a separate service? So I will say chronic care management and evaluation and management services are kind of their own beast. There's a lot of information on both of those topics. So those have been covered in webinars by my teammates, and because I don't know that I could get into all the details that you are wanting, I'm going to have Ashley add a link in for the evaluation and management playlist that is on our YouTube channel. There you can find there are webinars both on chronic care management and evaluation and management documentation. So hopefully one of those will provide the information that you are looking for. The next question I got was, is WPS's next eligible info accurate for beneficiaries with Medicare Advantage plans as well? No, it is not. The eligibility information that is found in the portal is provided by HETS, and that is eligibility data for Medicare fee-for-service, so basically original Medicare. And since those Medicare Advantage plans are provided by a private insurance company, HETS would not have any way to be able to track what services were billed. Maybe you could contact the company that provides the coverage. So whoever the Medicare Advantage care plan, whoever that's through, I would suggest maybe contacting them. I don't know if they'd have some sort of system for verifying eligibility, but the portal is just going to be a Medicare fee for service services that were provided. Give me one moment while I get a drink of water here. Okay. Next question, what is covered under preventive services? So I'm going to take you back to, if we go to if we go back to the Medicare Preventive Services, that tool, these are going to be your preventive services that are eligible for Medicare payment. Now, of course, each one is going to have different requirements, and there are some that have specific diagnosis codes. So that would be something that you could use to see what services are covered. If you wanted something specific for the beneficiary, then there's that little checklist that we looked at. There is also information in the Medicare Claims Processing Manual, Chapter 18, that covers preventive and screening services. The information that you find there, it's going to cover things like place of service to use on your claims, or like what type of bill has to be used for specific services. So that on the resource slide, that's that very last link. So it kind of depends on what information you're looking for. The Medicare Claims Processing Manual gets way more specific on what codes have to be on the claim and things like that, where this is more for coverage, things like that. The next question I got was, can you bill a preventive service at the same time? This is a question that I get a lot when it comes to the IPPE and the annual wellness visit. My best advice is to check the National Correct Coding Initiative tables. I am going to take you out to the CMS website and we'll show you how to get there. Let me get to the From the cms.gov, you're going to want to click on coding and billing, and then we have the NCCI edits. Now over here on the left-hand side is the procedure to procedure edits. This is really helpful when it comes to, can I build this service with this service? So it kind of splits the list into hospital edits and practitioner edits. So I already downloaded the practitioner edit to look at for an example. It's a zip file, so it kind of takes a while to open. So I wanted to have that ready for you guys, so we didn't have to waste time with that. But here is what the procedure to procedure table or the edits table looks like, which contains the code for the IPPE. So you can kind of see at the top there's column 1, and the code that you are going to want to look at in column 1 is the payable code. So for our example, we're going to want to put the IPPE HCPCS code in column 1. Now, column 2 is going to show like the other service that you may be thinking about billing. Then we have an effective date, we have a deletion date in case an edit's been deleted, and then the next column we want to look at is modifier. So if that column has a 0, that means that the services cannot be billed together, it's not allowed. If that column has a 1, that means that the services would be allowed to be billed together if the appropriate modifier were present. And then the 9 just means it's not applicable. So one of the questions that I get a lot is, can you bill a depression screening with the IPPE? Because there is that component where it talks about looking at, those signs for depression. So if we have in column 1, if we have the G0402 for the IPPE, and then we look at depression screening, which is the G0444, we have that in column 2. And if we move over, we can see this one has a deletion date. So I'm going to look at this row right here. And there is a 0. So that tells me that code G0444 cannot be billed on the same claim with G0402. So that was just one example. And I use depression screening, like I said, because I get asked for that one specifically. But this is just a really good tool that if you're wondering, can I bill this on the same claim? This would be something that could help you and let you know if that's allowed. The next question I got was, what is the major difference between 99387 or 99397 versus G0402? And from what I found, codes 99387 and 99397 are for comprehensive preventive medicine evaluations, specifically for someone 65 and older. It's normally used to bill a commercial insurance company and not Medicare. I also did find that there is a specific guidance from CMS that states that providers should not bill these codes for services that are covered by G0402. So I am going to have Ashley add a link into the chat for the CMS article, Medicare Claims Processing Manual Updates, HCPCS, Billing Codes, and Advanced Beneficiary Notice for Non-Covered Requirements. That's where you're going to find that in writing, so I just wanted to provide that for you. The next question was, do I have to do an EKG? No, that is not required. It should only be performed if it's appropriate. Next we have, what code do we bill if the provider misses one element on the list? This is something that I did bring to our medical review department, and what they had said is that if a component specifically it states at a minimum collect this information. So that little statement that I showed you earlier on that wellness visits webpage. Those are the points, like if those are not addressed in the patient's medical records, a claim could get denied if it were reviewed. Now, they've also stated that documentation can include things such as the patient doesn't need assistance performing ADLs. Um, so you don't have to maybe touch on each individual ones, but just kind of having a statement like we asked them about it, and they said they're fine. There's also some practices that have a patient fill out an assessment before they even come in, and then they just include that in the documentation. So I'm not saying that I'm not saying your claim is going to get denied if you don't put everything on there. I'm just saying that medical review has let us know those are specifically what they look for, is those bullets. That was all that I had for pre-submitted questions, so I'm going to ask Ashley if anything has come through in the chat.
Karen, we do not have any questions in the chat.
Great, thank you so much. So when you disconnect from the webinar, you are going to be redirected to a CMS survey. I'm also going to have Ashley add a link in the chat. And I really do hope that you will take a moment to provide feedback on how I did today. If you're watching this as an encore, it's going to be found in the description. But the redirect is going to look like what you see over here on the right. We just show you this because we don't have any control over how it looks. So we just want you to know it's not spam, it's nothing malicious. We have made some changes because of feedback that we got on our surveys. Chapters have been added to our encore presentations in YouTube. So those are, the timestamps that you find in the description of the video. So it lets you know not only what's being covered, but it also lets you jump to maybe the section that you want to hear most about. So maybe you don't care about all of the coverage part, you want to get directly to the building. So that's going to let you click right on the billing and find that information. We've also added training indicators to the descriptions of our webinars. That way you can kind of tell if the material applies to you. And a lot of times you can tell from the title, but sometimes we may have webinars that are only about information related to FIS or stuff that's only related to MCS. So that would let you know, like, the title may interest you, but they're only going to talk about FIS stuff, so I'm not going to go. We've also held 2 Medicare Education Expos based on suggestions for future education topics. We are currently planning a 3rd one to be held in January, so those details will be coming out soon. I just wanted to let you guys know that your guys' opinion does matter. We do make changes based on what you guys want. Now, after disconnecting today, you are going to receive a thank you for attending email that's going to contain contact hours that can be submitted for continuing education units. If you joined only by phone, WebEx is not able to generate this email, so you will need to contact us. So in the chat, Ashley's going to add a link to the education mailbox, and she's going to let you know what information is needed for us to send that certificate to you. Now, if you do think of any questions, those can be emailed for up to 7 days following this event. So that would be that same education mailbox that we provided. If you have anything, just send those in, put IPPE in the subject line so that those would be handled directly by me. Now, that does bring us to the end of today's presentation. On behalf of myself, Ashley, and the Provider Outreach and Education team, I would like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.